Brandon Musselman here, and we'll begin by performing the thumb ulnar collateral ligament laxity test. So for this test, you're going to have your patient have their wrist here in a supine position, and you're going to extend the thumb. With the other hand, you're going to create a valgus force on that thumb. A laxity of between 30 to 35 degrees would be a positive test. Brandon Musselman here. Next we'll be performing the Finkelstein's test. So for this test, you're going to have your patient create a fist by wrapping their fingers around their thumb. And while you support the wrist here, you're going to push it down to the ulnar side. Any associated pains that they've been feeling throughout the adductor pollicis longus or the extensor pollicis brevis would be a sign for a positive test. Brandon Musselman here. Next we'll be performing the Phelan's test to check for the integrity of the median nerve. So for this test, you're just going to have your patient flex their wrist together, and you're actually just going to push in and hold for about a minute. So any tingling that they might feel down their thumb, their pointer finger, or the lateral aspect of their ring finger would be a positive test. Brandon Musselman here. Next we'll be performing the ulnar carpal stress test. So for this test, you're going to want your patient to extend their arm in a 90-degree plane in relation to both their shoulder and their elbow. As the examiner, you're going to place one hand under the elbow here, with the other one, it'd actually be this hand, with the other hand clasped around their hand here, and you're going to bend the wrist to the ulnar side maximally, and then through passive supination and pronation, you're just going to move the wrist along this plane. Any reproduction of pain that they've been feeling would be a positive test. Brandon Musselman here. Next we'll be performing the lunotriquetral shear test. So for this test, you're going to have your patient rest with their arm rotated in a neutral position. And as the examiner, you're going to place your hand around the wrist here and have your thumb palpate right here while your fingers on this backside support the lunate. With the opposite hand, you're going to apply pressure right here to the pisotriquetral joint, creating a shear force to the lunotriquetral joint. Any pain or crepitus associated with this movement, as well as like abnormal movements throughout it, would be considered a positive test. Brandon Musselman here. Next we'll be performing the trigger finger test. So for this test, you're just going to have your patient resting their wrist in a neutral position here on the table. You're just going to ask them to flex their fingers like this here. And the finger that they're having issues with, all you're going to do is palpate right along the tendon there, and then have them begin flexing their fingers again. A positive test for the trigger finger test here would be if they were having issues flexing that finger that you're palpating, or if it's starting to get stuck or have abnormal movements. Brandon Musselman here. Next we'll be performing the varus valgus stress test for the fingers. So the reason you'd want to do this test is checking for a sprain of like the collateral ligaments. So all you're going to do is take the affected finger, we'll say it's this one here, and you're going to perform a varus test by grasping distally and proximally on the finger and creating a varus force throughout the middle there. Any pain or laxity associated with that movement would be a positive test for a sprained collateral ligament. And doing the valgus test would be the exact same, except you're creating a valgus force, which would be pressing outwardly on the finger here. So in here, next we'll be performing the elbow flexion test for ulnar nerve neuropathy. So for this test, you're going to have the patient supinate their wrist and have it in a neutral position here. And all you're going to do is maximally flex the elbow joint and keep it here for about 60 seconds. So you're going to monitor the patient at about 30 and 60 seconds to see their response. But any recreation of the pain they've been feeling would be a positive test. Brandon Musselman here. Next we'll be performing the chair sign test. So for this test, hopefully you have a chair that's a little more stable than a rocking chair, but it's all we have at the moment, so we're going to try and make it work. But with this test, you're going to have your patient seated in the chair, arms flexed at a 90-degree angle with their forearm supinated and arm abducted. And all you're going to have them do is try and raise themselves from the chair using only their arms. Any apprehension with this test or the radial dislocation would be a positive test. Brandon Musselman here. Next we'll be performing the lateral apprehension pivot test for the elbow. So for this test, you're going to have your patient laying here in the supine position. You're actually going to elevate his elbow above his head. From here, this camera might not be viewing everything. I'm just going to turn it there. From here, you're going to apply about a 20-degree angle in the elbow, and you're going to supinate the forearm. So with one hand here at the wrist and the other just above the elbow, you're actually going to push the forearm into the elbow, adding a compression force. Once that compression force is added, you're going to add a valgus stress, pushing down here at the elbow. So any pain associated with this would be a positive test. Musselman here. Next we're going to be doing the varus and valgus stress test for the elbow. So for this test, you're going to want your patient laying in a supine position, and you're going to externally rotate the humerus. From here, while the forearm is supinated, you're going to bend the elbow to a 20 to 30 degree angle, and with one hand supporting the wrist and the other supporting right here above the elbow, you're going to apply an adduction force through the arm. So while you're doing this, you're going to palpate the ligament here, and you're going to compare your findings to the other unaffected elbow. So for the valgus stress test, everything's the same. You have them in the same positioning, but you're going to apply an abduction force while palpating. And Brandon Musselman here. Next we'll be performing the Cosen's test to test for tendinopathy. So for this test, you're going to have your patient extend their elbow out here on the table, and as the examiner, you're going to hold the elbow in place while you palpate for the, I'm going to just start over again, that just sounded bad. Lateral epicondyle, like this right here. Lateral epicondyle. Brandon Musselman here. Next we'll be performing the Cosen's test to test for tendinopathy. So for this test, you're going to have your patient extend their forearm and their elbow out on the table, and as the examiner, you're just going to palpate for the lateral epicondyle on the outer portion of their elbow here. And from here, you're going to have your patient pronate and radially deviate their forearm while extending the wrist and resisting my force here. So as I try and turn, I'm still palpating the lateral epicondyle. Any recreation of pain or symptoms that they've been feeling through that elbow would be a positive test.